Welcome to Choices with Jeanette. I'm Jeanette Harris, and thank you all so much for watching Choices with Jeanette. Thank you for listening to Choices with Jeanette on KCOH on Saturday mornings from 7 to 8 a.m. Yeah, we're getting up really early. And thank you for shopping at Fiesta Mart stores. We really appreciate that. My guest is Dr. Eric Tait with Outreach Diagnostic Clinic. How are you doing?
I'm good. How are you?
I'm doing great. You have given me such great information. You know, sometimes when I do shows with dentists, I'm going like, oh my God. And I drop my head lower and lower and lower. But the thing is, when I'm talking to you, you're giving me hope. You really are. You've given me such hope.
That's the one thing we do have in this world is hope.
We have hope. And you made such a outstanding statement the other day when I met you. You were talking about you can manage someone's health only to an extent.
Yes.
People have to manage their own health.
Absolutely. So what I explain to my patients is that basically I can manage your chronic diseases. I'm not going to cure anything. In the end, patients cure themselves. We just create the environment in which they can cure themselves, and hopefully we can avoid some of the long-term complications of heart attacks and strokes, things that could be really disabling over time. And that's really all the medications we give for things like diabetes and hypertension, high cholesterol do. But essentially, people have the ability and the power to cure themselves from these diseases. But it takes, you know, it's, as we say,
it takes discipline.
It takes absolute discipline. It's simple, but not easy.
Wow. Wow. Now, at Outreach Diagnostic Clinic, you all do what?
And so we're a multi-specialty clinic. We have internal medicine, internal medicine is akin to pediatrics for children. So we're doctors for adults. We've trained pretty much all of our medical training is based on adult medicine. So we take care of weight management, high blood pressure, diabetes, high cholesterol, allergies, pneumonia, you name it. That's what we tend to at least diagnose people with.
Okay.
Not to say that we won't refer people out after, depending on what they have, but we're kind of the first stop on the line of diagnoses. Also in the clinic, we do offer interventional pain management, occupational therapy. We have a rotating ENT clinic, ENT physicians who come into the clinic. We also have a full-service eye clinic, and also an outreach portion of that eye clinic that goes out and reaches people in their homes who may be homebound and can't get out for their eye care.
Wow. And that really means a lot to some people.
Yes,
Dr.
absolutely.
CwJ has been doing a lot of that for many years.
Yes, I think he's the largest outpatient eye clinic, at least in Texas. Might be nationwide, but we know at least in Texas we have the largest program. All
right, then. Now, let's talk about, first of all, you finished from Baylor College of Medicine.
Yes, that's what brought me to Houston. I came to Baylor College of Medicine for medical school. I went to UTMB for residency and decided to stay in Houston and practice in Houston.
You like our city?
Yes, I do.
Well, okay, let's get down to the things that really matter. Hypertension, diabetes, and heart disease. We want to let's start with hypertension. Can we do anything about it? And what causes it?
We're actually not absolutely sure what causes high blood pressure. There are some people who eat a very good diet, who exercise, who maintain a good weight, who have high blood pressure. And a lot of times that is genetics. And so if you look, oftentimes both of their parents will have high blood pressure. And we haven't figured out exactly why that is. And this happens across racial and ethnic lines. Okay. But it predominates in African American communities in that way. For the rest of people, if people can begin to watch their weight, try to get down to as close to a normal weight as possible, watch their sodium intake, because right now the research shows that sodium seems to have something to do with it. Okay. There's some controversy there, but sodium seems to have something to do with it, and maintain an active lifestyle. Even if you can't get your blood pressure all the way to normal, you can make sure that you're not on quite as many medications. And so let's just kind of explain what high blood pressure is. Okay. It's sometimes called hypertension, it's called the pressure, it all depends on who you're talking to. And so that's just an elevation in your blood pressure. So we can liken it to a garden hose. Okay. And if you hold the end of a hose and don't let the water out, it's going to kind of get bigger and bigger and blow up. Well, you can liken high blood pressure to that, in that high pressure that's going through from your heart to the rest of your body, over time can damage the blood vessel walls. And it makes it easier for them to get full of plaque, which can cause heart disease. And it also puts you at increased risk for stroke, where basically you can have those plaques break off, go into your brain, and cause stroke. And so the leading cause of stroke is high blood pressure. The leading cause, one of the leading causes of kidney failure is high blood pressure, because all that pressure going into your brain, all that pressure going into your kidneys damages them.
You know, I keep a blood pressure machine with me at all times. I really do. I really do, because I'm constantly monitoring my blood pressure. I have a little arm cuff.
Well,
and I do that.
I will warn you against that, just from the standpoint, for two reasons. One, the arm cuffs aren't necessarily the most accurate in the world. Number two, if you kind of worry about your blood pressure, you can actually take it up yourself. And
that's so true.
And so what I tell most of my patients, even those with high blood pressure, take your blood pressure a couple of times a week if we're in the middle of changing medication or you think it's running high, and at different times of the day. Your blood pressure is actually highest in the morning. Because
why is that? Because that's what I've noticed.
Yes, so when you're waking up in the morning, your body gets a surge of hormones, and cortisol, which is kind of the wake-up hormone, more or less, is surging in the morning to wake you up. And so that cortisol...
I'm awake and I'm walking.
Well, the reason why is because of cortisol. Cortisol helps keep your blood vessels strong, and so it has a lot of different things it does in the body, but it has its release in the morning, and so it does raise your blood pressure. And so, not to say that you shouldn't check your blood pressure in the morning, it's just that understand that throughout the rest of the day, it's probably going to be lower. And what we care about is kind of what your average blood pressure is over a 24-hour period. Because there are people who will have high blood pressure their whole life and will never have a stroke. Okay? We can't predict that. But what we try to do is put you in the range of people who are least likely to have one, based upon all the people who've had strokes, kind of where their blood pressure was. And what we found is when your top number of your blood pressure, your systolic, is above 140, you're at 2 times plus risk of having a stroke. If your bottom number, or your diastolic, the down number, so D for diastolic for down, the bottom number, is above 90, again, you're at higher risk for strokes. And so ideally, if you can keep your blood pressure below 140 over 90, if you don't have any other medical problems, you probably will not be put on medication. You'll be told to diet, exercise, and the like. There's some special populations, those who have kidney disease, those who have heart disease, that may be asked to lower their blood pressure a little bit lower than that. Okay. But ideally, that's just once you cross that 140 over 90 barrier in either one of the numbers, they both don't have to be above it. If your number's on the top above 140 or on the bottom below 90, chances are your physician's going to put you on medication. And our goal is to get you below that 140 over 90 if you have no medical problems, and then kind of 135, 130 over 80 if you have diabetes or some other type of problem that can put you at increased risk for kidney disease.
So what can we do about it?
From a high blood pressure standpoint, the first thing is make sure that if you're seeing a physician at least once a year, if you don't have high blood pressure, just so you can be screened. If you do have high blood pressure, you're going to see your physician probably between 3 or 4 times a year, so he or she can keep an eye on your weight and just your blood pressure in general. Because understand that being treated for high blood pressure with medications does not cure it. You need to keep taking the medications for your blood pressure to remain in normal range. It's not, I've taken it for 3 months, I'm done, let me stop. Also, when you're going to see your physician...
It becomes a friend.
Yeah, well, it becomes...
a long time.
It becomes a needed necessity. It's a necessity, we'll call it. And understand when you're going to see your physician, please take your medications that day. For blood pressure, because a lot of people think that, well, I'm going, I don't need to take it. We need to see what your blood pressure is running on the medication. That way we don't give you too much or too little, or too much, we should say. And so please take your medications the day you're going to see your physician as well, and try to take your medication every single day.
Wow. I'm doing pretty good.
Yeah, that's
I'm
good.
doing good with this one.
And so you know, and I will have patients who will attest to that, physicians will take people off of medication if you're able to reverse blood pressure. And so what I have my patients aim for are kind of blood pressures in the 110s, 118, 115, 116, 120, on the top number and 70 to 80 on the bottom number, and I'll begin either decreasing or taking medication away.
Oh, great.
But they have to get to that stage on the medication. And once they do that, and they've proven that they can get their weight down, exercise, do those types of things, we then begin peeling medications off. So it's not as though once you start it, you're on it for the rest of your life. That's a misconception that people have.
Why is exercise so utterly wonderful for the body? Why was the body made to move around when I know God knew we were going to discover TV?
Well, what ended up happening was, if you look at the evolution of human beings, we went from hunter-gatherers to farmers. But to get protein, you had to go out and kill something. You had to go kill whatever it is you were killing. So we ran. We did things in bursts of energy. That's kind of how we evolved. This is the first time in human history over the past 500 years that human beings have more food than they know what to do with.
Wow.
If you really think about it. So you have the pilgrims come over here, they bring their slaves, they bring what people were tilling and working the fields. You could only gather as much as you grew on your own land for the most part. There weren't supermarkets. There may have been farmers markets, but there weren't supermarkets. And so there wasn't this utter bounty of food, and especially fast food. Most food had to be cooked, so you had to sit around. And so that tempers how much you can eat by how quickly you can get it out of the ground. We don't have that anymore. There's a McDonald's on every corner. There's a Burger King. There's a Kentucky Fried Chicken. There's meals ready to eat out of your local supermarkets. So food is abundant for the first time in human history, when most of human history has been marred by humans trying to find food. We didn't evolve to just have food in a plenty, so that's what we have right now.
Wow. Now, let's go to diabetes. Okay. I just declared I would never have that disease. The side effects and the after parts of it are just too much to deal with. And so I've made sure that I've checked my blood continuously and watched how much sugar my intake on sugar. I've watched my intake on sugar as well as my intake on fat, because fat turns into sugar. And so,
well, fat doesn't turn into sugar, but carbohydrates turn into sugar.
Carbohydrates,
well, they are sugar.
Yes. So I've kind of watched those, and I exercise.
Yes. Yeah. Well, of the three things you just said, the most important thing there was exercise.
I know.
And so you asked me a second ago why exercise is so helpful, why the human body is so helpful. Exercise is the only fountain of youth that we've found in human history. And so I can go to the genetic level if you'd like, and probably your listeners don't want to go that far down.
I want you to go there. Please go there.
So there, on the end of our genes, there's something called telomeres. They're basically the caps on our genes. And as those caps wear out, scientists think that has something to do with the aging process.
Okay.
And they're called telomeres. Well, what we found is that when you exercise, especially if you exercise vigorously, those little telomere caps actually elongate.
Oh, really?
And they get longer.
Oh, really?
And so the longer your telomeres are, the less you're going to age over time. And so from that standpoint, when I tell my patients is, if you want to feel better,
exercise.
There's nothing anybody in a white coat's going to do for you to make you feel better. You have to exercise, because that's the only thing that has been proven to delay the aging process.
I bet there are a lot of people who are going to hear you, and they're going to start exercising. They're going to say, "Oh, is that the fountain of youth?"
That is the only fountain of youth that we've found so far. Now, I guarantee you, scientists are trying to bottle this, but it's the exercise.
Now, is type 2 diabetes reversible?
For many people, it absolutely is. And so let's break up diabetes quickly. Type 2 is the type that most people consider when their friends, family members have the sugar diabetes. All of that is usually type 2 diabetes. And that's 90% of diabetics. The other type is type 1 diabetes. That tends to happen in children, and it's where their body doesn't have any insulin. In type 2 diabetes, your body has tons of insulin. That's actually too much.
Too much.
Your body can't use it because you're out of shape. And so what diabetes does essentially is when you have insulin basically creates a hole in your muscle so that sugar can get in and your body can use the sugar. Okay? And so when your muscles are not in good shape, it takes more of the insulin to try to poke the holes in so the sugar can get in. And so sometimes you'll see diabetics with a kind of dark ring around their neck, or people with that dark ring around their neck that's not dirt. That lets you know that their body's making too much insulin oftentimes.
Oh, my goodness.
And so they're not diabetic yet, but they probably will be within a year to 5 years.
Wow. How much could it help if a lady told me probably in 2002, that's 10 years ago, Jeanette, because I was talking to her about the same thing, I don't want diabetes. And she said, make sure after you eat, you always go for a walk. How important is that?
Well, in the end, any amount of exercise is always helpful. Okay,
We're still on that exercise.
that's the only thing. Of the top 10 killers of people in the United States, 7 of them are related to diet. What you eat and how you do or do not exercise. 7 of the top 10. So all of our health goes back to the lifestyle that we live in this country. And so whether it's after a meal, before a meal, just get some good exercise in. As intense as possible, as intense as you can stand, as intense as your physician will allow you to do.
Okay.
But intense exercise, especially aerobic exercise, so biking, jogging, swimming, those types of things, even for short periods of time, are very, very good for you. I would recommend them over kind of walking for 3 miles. If you could jog or sprint for a half a mile or a quarter mile, going as hard as you possibly can, 3 or 4 times a week will probably get you more from a diabetic standpoint in terms of your muscles being able to use the insulin and use the sugar than just basically walking at an easy pace for 3 miles that you can talk with somebody and kind of laugh and joke with.
Oh, really?
Intensity of exercise, research is finding, is counting as much as anything else. Because there are lots of people who are very overweight who exercise on a regular basis, not very intensely, but they exercise, they do something, but it doesn't do a thing for them.
Wow.
It's the intensity of the exercise that we're finding with new research. It's really going to be a big deal.
Wow. So if you could change anything, I know at Outreach Diagnostic Clinic, you all work on a lot of different parts of the body.
Yes.
If you could change anything in your lifetime, what would you like to see?
The linking of food, what we take into our body, and health in Western medicine. Because Western medicine is the only medical system that has delinked diet from health. And there's no way what you take in doesn't affect your body. What we say is food is medicine, and it is. Just like we give you an aspirin, we give you a blood pressure pill. It has some good effects, it may have some bad effects. Food is the same exact way. But nobody looks at food as medicine. But food is medicine. And so the fast, greasy food, if you're doing that all the time, that's what you're fueling your body with. That's what you're doing to your body. So essentially you're giving your body bad medicine all the time. Now, I don't ever put patients on diets. What I tell them is everything in moderation. And so if we can control portion sizes, that's the biggest thing. You'll never hear me tell a patient, don't eat this, don't eat that. What I'll say is, essentially, this is a plate, this is a platter. Eat a plate.
Wait a minute now. This is a plate.
This is basically a plate. Now my hands are a little bigger than yours, but
this is a plate. This is a plate.
Anything bigger than that is a platter.
This is a saucer, Dr. Tait.
In our country, it is. But for the most part, if you look at how many calories you actually need a day,
it could fit in here. In this.
If you eat 3 of those a day with a snack or 2 in between, yes.
So this
in terms
is
of total
the plate.
calories, a little bit bigger, but yeah, that's a plate. And so what I tell patients is to fill this up, mostly with protein and not a lot of carbohydrates, but protein and vegetables. Drink a full glass of water after you've had one of these, and wait 10 minutes. If you are still actually hungry, not just your appetite calling, but you're actually hungry, then go back for a second plate. But if you're
And
not
this
actually
is a platter.
That's a platter.
Well, what is this thing they bring you at these restaurants?
Diabetes. And a big gulp like this. You know how much sugar is in this? A week's supply of human sugar is in one of those big gulps. And so our inability to push back and push away from cheap, calorie-dense food is why we're absolutely eating ourselves to death.
Wow.
There's hope.
Well, I did that. I made myself I put my plates up, my platters up, and I went to, it's a bowl though, and it's about this size. And so I started eating out of that, and then when I'm trying to lose weight, I'll eat out of what I call a saucer. And so And so I've never heard anyone say that, when we really appreciate that information.
And if you look at most of the diet plans and meal plans at work, whether it be Weight Watchers, Nutrisystem, all they are caloric restrictions. They give you the food you're supposed to eat, don't eat any more than that. And it's just portion control. You're just eating less
portion control, always.
You're just eating less than what you normally would eat. You know, by golly, you lose weight. I mean, in the end, even if you don't exercise ever and cut your calories, you're going to lose weight. People don't understand that. It's probably 80-20 caloric restriction exercise in terms of weight loss. And in the end, if you talk to most of my patients, I don't obsess over their weight. What I obsess over is them being physically active, because that's what reduces the diabetes, that's what reduces the hypertension. The weight loss may be a nice byproduct, but being physically and cardiovascularly active is what reduces and lowers a lot of those bad things with hypertension and diabetes.
We've talked about diabetes. We've talked about hypertension. You're giving me such hope that we can do something about it. We can cure ourselves.
Absolutely.
And then we talked about heart disease. So we're going to have to do another show with you about the heart disease. Tell me something about the medicines that are out there for those two diseases.
Oh, goodness. There are a litany of medicines.
A litany.
There are very many and new ones coming out every day. But essentially, let's just take diabetes. There are pills out there that either increase the amount of insulin in your body, which we already talked about with type 2 diabetes. You already have too much. So essentially what we're trying to do is force more into your cells. We have pills that also decrease the amount of sugar your body makes, because let's think about it, at night when you're not eating, you still need sugar. Your brain runs off of sugar. And so your liver actually makes sugar when you're not eating. So the 8 hours that you're asleep, or hopefully should be sleeping, your body actually does make sugar. Well, that process in type 2 diabetes gets all haywire. And so we have medications that stop that process from your liver making that extra sugar, which helps to keep your overall average blood sugar down. We also have medications that help your muscles to take up the sugar a little bit better. And there are more of those coming out every day. And then we have the insulin. And so everybody knows about the insulin. Everybody is scared of insulin. Everybody thinks, oh, I get on insulin, I'm going to get my foot cut off. No, that's not the case. What happens is insulin is oftentimes the last line drug that we use.
Okay.
And so it's for people who've gone so far already that we're trying to get them back. It just so happens that sometimes they've gone so far that the other things happen. But insulin doesn't cause amputations or dialysis or anything like that. And in all honesty, we should probably be using insulin earlier than we do, but because patients kind of are resistant of it, we don't. And then there's one other class of injections, because insulin is an injection. There are another class of injectable medications that are hormones that our body makes. They're not very well-known hormones, but they mimic much better than us just giving you extra insulin. They kind of help to try to re-regulate our appetite and how our cells take up sugar and how our pancreas puts out certain hormones besides insulin. And it's fairly complicated, so we won't go into it here, but there are more of those coming out that are actually helping people to lose weight as well. And so those are sometimes 1 shot a day, sometimes 2 shots a day, but they're not technically insulin. And if we look at high blood pressure, again, most of the way they work, they try to either stop the body from making hormones that increase our blood pressure, or they allow our blood vessels to relax a little bit so our blood pressure falls. There are just a number of classes of blood pressure medications. There are hundreds of them. But essentially what they're trying to do is just bring down that pressure, that forward pressure that you feel within the body. And based upon what type of medical problems you have, your preference, your job characteristics, your physician will decide kind of what's going to be best for you. But any number of pills can get, any combination of what I just said can get you down. So there's no absolute right way. And a lot of it is experimentation from the standpoint that what's going to work for you, you're going to say, yes, this worked perfectly fine, and we'll use it. It's not like we're experimenting like we've never used these drugs before. We have patients on all of these drugs. Some work out well, some don't. We just switch to something else. You have to be patient during what we call the titration period. When we're adjusting the medication to get it right where it needs to be, there are going to be some hiccups. There are going to be some, it's not that we don't know what we're doing, we just don't know how your body's going to react to it.
Absolutely. One last question.
Yes.
Symptoms. Let's start with diabetes.
Okay. And so
people can know, I need to go have this checked. I know I just saw my doctor, but this is a little bit different. What do they need to be looking at?
And so for people who have undiagnosed diabetes, oftentimes what you'll end up getting is severe thirst, severe wanting to drink lots of water all the time, and you're always going to the bathroom, always peeing, and with that, oftentimes you will get yeast infections, and even men. If a man gets a yeast infection, especially an uncircumcised man, and gets a yeast infection, oftentimes the first thing we check for will be diabetes.
Okay.
Weight loss, unexplained weight loss, along with the thirst and going to the bathroom all the time and feeling very hungry. You're eating, you're drinking a whole lot, but you're getting smaller and smaller. That could be diabetes as well, because your body can't use the sugar. So the sugar is making you pee, because that extra sugar in your bloodstream makes you dehydrated and makes you pee more, urinate more. And because your body can't use the sugar, it starts taking fat. And so it takes the fat and converts it to sugar so your brain can use it. And that process makes you lose weight while you're going to the bathroom all the time, very thirsty. And so that oftentimes are the big symptoms with diabetes. For high blood pressure, kind of an unexplained headache, kind of a feeling of fullness in and around the chest and neck and head area.
Okay.
Especially towards the end of the day, oftentimes can be a sign of high blood pressure. It's easier to check because you can just go to Walmart, Walgreens, nurse's office to get your blood pressure checked. So it's easier if you're having those symptoms to get that. And again, anything 140 over 90, you need to go see your physician.
You still gave us hope.
There's always hope. There's always hope. Again, it's simple but not easy.
So, people need to be responsible for themselves.
Yes, absolutely.
And if they need help, they need to come to Diagnostic. And if people need to be responsible for themselves, or they need to come to Outreach Diagnostic Clinic and see you.
Well, it's both. They can come to Outreach Diagnostic Clinic and see us, and they're still going to be responsible for themselves, but we are their partner in health. And so we're always there as a partner to at least guide and tell you what you should be doing. And then it's up to you all as patients, as citizens, to decide whether or not it's important enough for you to do that.
Wow. So there's hope.
Absolutely. There's always hope.
And maybe one day they'll go ahead on and link. As you said, you wish you could see that.
Yes, that people understand that what you're putting in your body is fuel. It can be entertainment. It can be sumptuous. It can be great. But it doesn't need to be a platter.
Stop the platter eating.
Stop the platter eating.
Or share the platter with someone.
2 or 3 other people, yes.
Oh, you say 2 or 3 other people. Okay, and Outreach Diagnostic Clinic is at 2000 Crawford.
Yes.
You all are conveniently located away from the medical center, which gives you a chance to come, especially if you work downtown.
Absolutely.
Just come on by. There are appointments available.
Yep, there are appointments available. Parking is relatively cheap. We have valet service in our building, and we can get you in and out pretty quickly.
Yeah, and that's what people want. They want to take care of themselves, but they want to integrate it into their lives and not spend a day at the doctor's office.
Absolutely.
Absolutely. Well, thanks so much. You'll join me again?
No, thank you so much for having me.
Okay.